We're just hours away from the Obama administration's self-imposed deadline to get healthcare.gov working properly for most users. The administration set a November 30th date to have many of the problems resolved. Healthcare.gov opened for business October 1st, and it's been a difficult 2 months. The site crashed and was unable to cope with people trying to sign up. Small businesses still won't be able to use the site for another year. The White House says the site will be able to handle 50,000 users at one time, but they admit there will be times after Saturday when healthcare.gov does not function properly. Officials say consumers who pick a plan by December 23rd and pay their premiums by December 31st will have coverage effective by the first of the year. Now, those who don't already have insurance must enroll by the first of the year or pay a penalty. Here to talk more about Saturday's deadline is the founder of Rochester for Obama, Ken Preston. He also organized a local effort to support the Affordable Care Act. Now, Ken, Kathleen Sebelius said earlier this week that Saturday really wasn't a deadline, more of a benchmark. So is Saturday significant in your opinion?
No, and the reason that it's just a benchmark, you know, the administration is trying to measure, you know, how many people access the website, how many people are successful in signing up, so they have a gauge. A number of dates have been pushed back because of the problems with the website healthcare.gov. So no, people shouldn't get nervous. They still have plenty of time to sign up for the healthcare insurance that they need.
Okay, now you mentioned that in there real briefly that the president has been willing to delay portions of this law, but he has been unwilling to delay the individual mandate. And he's been receiving some criticism because of that. So my question is, why not delay the individual mandate? Why not step back for a year to make sure all of the problems that we've seen with the rollout are worked out?
One of the main portions of making the Affordable Care Act successful is having buy-in from all of the citizens who need health care and who can't purchase it through their employer or on their own. It would be similar to the way health care was provided and paid for in this country before the Affordable Care Act. You know, people who didn't have insurance couldn't afford it or didn't worry about purchasing it because they couldn't get it from their employer or whatever. They would show up in the emergency room, sick, shot, wounded, whatever, and then somebody has to pick up that cost. It was primarily the middle class who had to pick up the cost of caring for those people in the emergency rooms. And as we all know, care in the emergency room is a lot more expensive than checking into a hospital in a routine way. So that's the main sticking point. You know, you're letting people still, the president says, game the system. You know, they'll wait until the 11th hour to purchase health care. It would set a bad precedent, I think, to let people skate.
Ken, you know this in your efforts to raise support not only for the president but for this law as well, that public opinion is important. It seems like the rollout and the problems with the website have affected public opinion in a negative way for the Affordable Care Act. Do you think the damage that's been done can be undone at this point?
Oh, yeah, definitely. There's a report that people can access on the internet by Googling the Council of Economic Advisors. This is a group that's part of the executive branch of the White House, and they're advisors to the president, independent from the administration. And they just put out a report a few days ago, and it speaks highly of the good that the Affordable Care Act is doing for the economy here in this country. There's been a number of large organizations who've had rollouts on the internet. Primarily, a lot of people have forgotten, you know, Microsoft. They used to have big-time problems with their websites. There's been other companies. There were problems with Medicare Part D when Bush was president, and he rolled that out. So there's always problems on the web. We know in our daily life sometimes our wireless doesn't work, sometimes our Ethernet doesn't work. But I think as we move along and the president and the administration adapt to the glitches and push dates back to allow people more time to do what they have to do to sign up, I think people will be able to live with that. One of the main problems we're having is the Republican Party in Congress. They've voted 43 times already to repeal the Affordable Care Act. And, you know, they should be I think working with the president and advising citizens on the good parts of this program, and I think they're all good. It's just that everybody doesn't think so.
Ken, you mentioned the private companies. You mentioned Microsoft for an example, but typically when there's problems in the private sector, usually somebody is held accountable for it. Somebody loses their job over it. Now, the president has been very quick to close ranks around his people. He's very loyal to the people that he appoints to his cabinet in those high-ranking positions. But if the problems continue after Saturday into next year, does Kathleen Sebelius need to pay with her job, in your opinion?
I don't think so, and that's above my pay grade. But, you know, if we look back at the 8 years that George W. Bush was president, he was the same way. He was always loyal to his department heads as well. And the bottom line is, Casey, firing 1, 2, 3, 4 people is not going to help the American citizens who are trying to sign up for health care insurance. What's going to help them is having the website work correctly so that people can sign up. So, you know, calling for people's heads is not always the best option. And the people who are working there now have been with it from the beginning. So I believe they know best on how to fix it. And, you know, we're all humans. I mean, we all have problems with technology. So for a symbol, maybe that might work, but it won't help the 40 to 50 million people who want to sign up for health care because one person's fired. They need the website to be fixed so that it works. That's my opinion.
Well, we always value your opinion. Ken Preston joining us from Rochester for Obama. Now, there is a number that can be called if problems persist with the website. The Affordable Care Act customer service number is 1-800-318-2596. Again, if you want to see my full interview with Ken Preston, you can head to our website, ynn.com, as well. Ken, we appreciate you joining us tonight. Thank you.
Thank you, Casey.